NeuroBlate surgery is a means of using a laser to destroy tissue in the brain. Usually this is done for destroying tumor tissue, although it can be used to destroy abnormal tissue that causes epilepsy. The way NeuroBlate surgery is different than conventional surgery is that the NeuroBlate procedure is minimally invasive. Unlike a craniotomy, which requires holes that are 2 or more inches in size, the NeuroBlate procedure itself is done through a 1/4-inch hole and more or less a stab incision. The principal advantage of minimally invasive surgery is that patients oftentimes go home the next day and have very little pain, and also may then be able to undergo treatments such as radiation and chemotherapy if required much sooner than if they underwent a conventional craniotomy. In terms of the types of brain tumors that NeuroBlate procedure is effective, usually it's tumors that start in the brain itself, known as gliomas, or it can be used when either radiosurgery, such as Gamma Knife, has failed, either in terms of tumor recurrence or to treat a radiation injury. To determine if you're a candidate, you can send your imaging to the Rosella Burkhardt Brain Tumor and Neuro-Oncology Center, and one of our neurosurgeons will review the imaging to determine whether you indeed would be appropriate for laser ablation. The NeuroBlate procedure works by placing a laser probe in the area to be destroyed and then monitoring it with an MRI machine that is used during the actual ablation. In terms of preparation, you'll be getting some MRI scans that are used for planning purposes that show us not only the area to be destroyed, but important structures nearby that we need to preserve. Patients will then get their final scans after they're asleep under a general anesthetic during the procedure, which itself takes anywhere from maybe 3 to 6 hours. Most patients who undergo a NeuroBlate procedure only require one procedure, but if at some point down the road the problem recurs, we can always consider repeating the procedure. The recovery period after NeuroBlate surgery is typically much shorter than for open craniotomy. Patients typically are discharged 1 to 2 days after the procedure and have resumed most of their activity within 1 or 2 weeks after the procedure. The NeuroBlate procedure is not an experimental procedure, so the vast majority of insurance companies as well as Medicare pay for this. So as a patient, you should have very little difficulty navigating your way through the approval process. So the reason why you should choose Cleveland Clinic for your NeuroBlate procedure is because we are one of the most experienced laser ablation centers in not only the country but the world. And indeed, we were the first to actually ever use NeuroBlate in humans.